In Bangalore, Victoria Hospital's Trauma and Emergency Care Center turns to Dozee's remote patient monitoring system to transform public health care. 144 step-down ICU beds installed through the Million ICU initiative by Dozee to create smart wards to monitor 3,500 plus patients. The press meet was held with Dr Deepak S, Special Officer TECC, Victoria Hospital, Mr.Ramesh Revanna, Nodal Officer TECC, Victoria Hospital, Mr.Mudit Dandwate, CEO and Co-Founder, Dozee.
I'm Dr Deepak, Special Officer of Trauma Care Center, which is a 200-bedded facility in the Victoria Hospital campus. And he is our Dr Ramesh Revanna is a Nodal Officer, and Dr Vijay Kumar is a Critical Care Consultant and the Head of the Department. Here I'm happy to welcome you all to have some information about the new Dozee, that Million ICU system, what we incorporated in our setup, and especially in the COVID times. So in the last 2 years, I think we have seen around 12,000 patients in the whole of Victoria Hospital campus, and ours was the first COVID hospital, designated state COVID hospital in the state, and the amount of serious cases coming here, it was a tremendous pressure on us, and we were having difficulty to maintain and monitor the patients very effectively. And I think at the end of first wave or beginning of second wave, we introduced this Dozee system into our system. This Dozee system is the one where we can monitor all the vital parameters by attaching a gadget to each of the beds and monitor at the central monitoring system. So this will help in many ways to monitor many patients at a single place with minimal HR persons, especially in the times where many of our healthcare persons were scared to go inside the wards wearing PPE kits and all, one. And two, stress was less because we used to know which patient is bad, which patient is good. Because the monitors will bleep us, and even it bleep us in our gadgets, that's in our mobiles also we had software. So in that way the monitoring was very useful, and I think Dr. Vijay Kumar will highlight you about the exact use of monitoring Dozee system more effectively and technically, because he is a specialist in that.
During the COVID, we know there was scarcity of beds in the ICU also. And Dozee really helped us picking up the early warning signs, and they had early warning scoring system, and it helped in shifting the patient, picking up which patient is going bad in early very early, and send them to ICU. That way, you can pick up which patient among the patients, which patient is very critical, and you can shift the real ICU, and you can be prepared, and you can be avoid the adverse situation in those patients. That way, Dozee really helps in picking up the really critical patients.
Dr. Ramesh, pulmonologist, and then the Nodal Officer. I've been watching this Dozee from the remote control place, or where our student was very, very helpful. The interface of Dozee is very nice. Immediate alarm will be issued, and those will be attended. See, if doctor will be having a lot of pressures, they will be taking care of a lot of pressures. During COVID time, we were restricted the doctors because the care and there was a rotation on duties. The doctor should have given off and other things. Each doctor, one doctor, 6 beds or 5 beds we used to manage, and 6 beds, any emergency attack, within a minute is to know. Otherwise, individually the doctor should go to the place, check BP, check pulse rate, and make sure that any problem is there. Then it takes a delay of 5 minutes. That delay of 5 minutes also was well covered with this Dozee. The interface system was very good, and it was very helpful for our patients, and also monitor the people outside, because the monitor was connected outside for the administrators and other people who used to come to know and tell what are the action to be taken place for the patient, and the immediate response was given. The patient was resuscitated, or drug was given, whatever the problems were solved immediately, and there was no negligence or any other chances were given, because it was totally monitored by the system. And sometime if doctor little bit gone to somewhere, the nurses were informed about the monitoring blood rate, and they used to inform us. Like continuous monitoring was made in this during COVID system, and Dozee Millennium unit is really helpful, definitely helpful for the patient when it is in a large scale like trauma center, COVID crisis, or any other crisis which is happening in the future. It will be very helpful. Thank you very much.
Morning into this Victoria campus or outside?
Sir, the thing is, sir, we had one war room. We had the Dozee monitor. What is connected? It was connected there also. The live was there. They used to come to know what is going on here. That's why they used to come. Know the problem there, because in war room the people were 7 to 8 people were sitting, doctors. They used to see what is the monitor, what is the pulse rate going on, BP is going up or down, or the patient respiration is going up or down. Those are the monitors. This is basically vital monitoring. See, internal we can't tell how X-ray is going, how lungs is working or anything. But externally, whatever the internal feeling is there, if a problem, a patient started occurring, his BP decreases, pulse rises, and respiratory rises. For that only will come the early indication. Like that can be monitored, and so if patient needs some drug or anything, they used to give a drug like that. That was the individually patient was benefited in a minute. Or if a doctor want to be there, he will take another 10 minutes to check, tell, and call the VAR system. It will take almost time. No, the system will be known there only. There were HODs there sitting sometimes and other associate professors.